Hello, and welcome to the recap of the COVID-19 storytelling series. So in this series, we spoke with Tehama County residents from various walks of life to learn how they experienced the COVID-19 pandemic. So it's the first pandemic of the 21st century, and we wanted to document these stories not just for their personal value, though they're very valuable, but also for the insights that they provide to future generations who might not have lived through a pandemic and want to be better prepared for future challenges. So we heard from Ashley, who is a special education teacher in Red Bluff, and then we heard from Nancy and Teresa, who are a mother-daughter duo who shared how their family relationships changed during the pandemic. And then we heard from Amanda, who worked in healthcare throughout the crisis. We heard from Alberto, a small business owner who transitioned from a storefront to an online and flea market business model. And then we heard from Casey and Michelle, a small business owner duo in Red Bluff who expanded their business during the pandemic while balancing various other jobs. And today we're joined by two special guests who are going to share their reflections on the pandemic as we wrap up this series. So let's jump in. So thanks for joining me this morning. It's great to see you both.
It's great to be here. Thank you.
Can you both introduce yourselves to our audience?
Good morning. My name is Kalie Brisbane. I'm the Chief Operating Officer for United Way of Northern California.
And Minnie, what about you?
Yes, hi. I'm Minnie Sager. I'm the Public Health Director with Tehama County Health Services Agency.
Great to have you both here with us at United Way. Thanks for coming in. So over the course of this series, we've heard from 5 individuals who shared their very unique experiences during the pandemic. A common theme that we've touched on is that although COVID-19 was very challenging for people, and we know that, we also know that there were some positives that did come out of COVID-19. So what were some of those positives that actually came from COVID-19?
I think from the healthcare side of things, there was a lot of positive outcomes. For one, when we think about when COVID first started, there was no way to test for it. And then when they developed the test, the first test that they developed was actually one that could only be done in a laboratory. Over the period of the 3.5 years of the pandemic, they then evolved that test to a rapid test where people could do it at home. So I think that that speaks a lot to our ability as a country to rally and scientifically get where we need to be to develop testing for things that we're not sure about. There was a lot better communication that started to happen among health agencies. And that relationship building has lasted even to this day, which is very nice.
Collaboration and communication increased in a really wonderful way. We made progresses in the ability to provide access to community members to certain services through telehealth, through Zoom, through phone calls. Our 211 24-hour helpline was able to take calls fairly quickly after the pandemic emergency was called and start answering information provided by public health so that it was trusted. We also saw flexibility of people being able to work completely remote or partially remote, and that way be able to care for their kiddos who were doing school from home or be able to protect themselves because they were vulnerable or at risk. And I think that those innovations were critical to make it that time.
What do you think it was about the pandemic that helped us to collaborate?
I think it was just necessity. You know, and then they say necessity is the mother of all invention, right? When you have to pivot and make changes in order to respond to an emergency, you do what you have to do. And I think that's inherently built in us as human beings.
Yeah, change is so scary, but we're eager and willing to do it if it means surviving and if it means doing better once we know better. And so it really accelerated that need for some changes under that pressure. I was running the 211 team at the time, and I knew that my team needed some stability and that we were going to be working around the clock to support the 24-hour call line. And so we worked remote for 15 months, and that was a really key decision that allowed for some stability. And I think that's what people were craving during that time, and maybe craving always.
In my role in public health, we work very closely in emergency preparedness and helping communities be resilient and prepared for anything that comes up. And the one thing that I have truly come to admire in my time at Tehama County is the cooperation and the collaboration among both government agencies, nonprofit organizations, to help build that resilience. When we have had situations come up with natural disaster, you really see those partnerships in action. It's really a wonderful thing because we are a small community, and that level of resiliency and partnership is necessary because we don't have some of the resources that some of our larger communities have. And that's even with some organizations shifting within their leadership. There's still that good cooperation around these issues.
Absolutely. Tehama County is a gem to work with because of the collaboration and coordination. It means that we can maximize the different resources we have, and it benefits the people in the end so that we can respond. I think when we're talking about preparedness towards resilience, we really have to have each individual take responsibility for their own preparedness. And once they are prepared, if they're able to be prepared, then help others, whether that's their family members, their loved ones, their kiddos, or their next door neighbors. And if someone's unable to get themselves prepared, that's when they get to ask for help, of course. And there's so many agencies, like going back to the collaboration, Disability Action Center, you can call 211 and there's lists of what we can do to get help out to people ahead of the emergency. So there's all kinds of preparedness, education, and information that United Way of Northern California can provide, that we provide in partnership with public health and other county agencies. But it's very important that we just get the general sense of urgency across, that we've lived through one pandemic, we've lived through wildfires, we've had enough signaling to know that there can be unplanned emergencies and disasters. So let's take a step forward, and if we need to ask for help, let's ask for help. And I believe that'll make us stronger, more resilient, Tehama County and North State region.
So we've heard a lot of insight from our interviewees about what advice they would tell their past selves to help get through the pandemic, or how they would maybe advise future generations in a similar circumstance. So Ashley talked about staying calm and trusting that you can handle it. And Alberto pointed out the importance of having a backup plan, and since you really never know what's going to come next. And then Nancy and Teresa talked about spending time with loved ones and how much that matters. So now I'd love to hear from both of you. What advice would you give your past self or future generations who might have to face another pandemic?
Really cherish the time with your loved ones. We isolated out of fear and protection of each other and of ourselves, and we're still paying for that isolation. It's really important that even though we needed to be apart physically, that we still maintain strong community connection, whether that's family community, your friends, your clubs. The isolation won't serve in any crisis, and really just encouraging people to reach out, talk to your loved ones, connect with your loved ones. Try not to act from a place of fear, but a place of awareness and action on what you can do using Zoom or phone calls or picture messages or whatever it is to connect with people.
I think it's important to realize that when it comes to health, human health, it's not just what happens in the doctor's office. Health is really impacted by our social constructs, our ability to access quality care, our ability to access education and get the health information that we need in a way that we can understand, and our ability to live in safe neighborhoods, right? So all of those components impact our health. You know, we refer to that as the broader determinants of health in the public health field. And I think one advice that I would have for future generations is prevention is key. So whether it's in your personal life, think about what you can do to prevent negative health impacts. If it's in your professional life, what is it within your industry that can actually help promote the health of the community or even within your own organization? Ralph Waldo Emerson said it best, right? There is no wealth without health, and that's true. Do the basics, eat right, exercise, get your preventative screenings, and that includes not only your physical screenings, but your mental health screenings. Not that it's going to eliminate you ever getting sick, but if you take those preventative steps and you encourage your friends and family to do the same, if they get ill, it's going to build their resiliency to be able to get better and heal.
Okay, thank you both for sharing.
Thank you, Abby. I really appreciate having the opportunity to talk about the pandemic and highlight those areas about the pandemic that were more positive in nature.
Yeah, thank you so much. Thank you, Minnie, for joining us, and it's been an honor to walk through this for our community and with our community.
And that is a wrap. So thanks everyone who's joined us, for Minnie and Kalie for being here this morning. And we hope that these stories have resonated with you. We hope that they offer some insights to help us all face the future with a little more resilience. So thanks for joining us.